The best way to maximize the capacity of the space is to efficiently utilize your chair time, which of course can be a little bit more difficult when you're dealing with patients that are ill. So having patients that are still within that 5-day window, if we're able to have them come in perhaps the following day, we would really recommend and push that early 7:30 a.m. slot so we can have up to 5 patients in those chairs in the early morning hours. So really selling it to the patient to be able to get them to come in early, it is important. I think also within a COVID unit, especially here in New York City, we don't really have the luxury of space. So these patients are infectious and symptomatic with COVID. So you really can't have any patients overlap and they have to immediately go into their individual rooms. You don't want them exposing other patients unnecessarily. So it's really important to just make sure you're utilizing your schedule appropriately, never overbooking, and ensuring that there's always an open chair when that patient comes into the room. I think it's really important prior to opening to have an SOP in place for the nurses and nurse practitioner and pharmacy and administration and operations to follow. There's many different people involved within this process, and it was a quick turnaround time to open the unit. So I just think that the collaboration is really key, and we had a wonderful team at Mount Sinai that was able to work collaboratively to get the unit open. But I think having that SOP written up in place before you treat your first patient to be available for anyone within the unit clinically and administratively to reference is a really important part of opening the unit.
For setting up operation of a COVID infusion unit, it's really important to also include the nursing staff to look to see if the unit is well equipped to accompany a certain type of acuity of a patient. For instance, do you have the proper trach care supplies that you would need, include suctioning, aerosolization? Do you have the correct, any type of reaction type emergency medication that you would need? So it's really important to make sure that you're able to accommodate certain patients that are coming in from the community, especially if they have multiple comorbidities.
Things we've done to make efficiency with the education of the pharmacists, it's become much more standard. They know what they're doing. They become more comfortable as they make more medication. We have tried to remove the pharmacist approval process, really making it more so that the person who is referring has all the information they need to make sure that the person they're referring is appropriate. And then we have a screener before they actually make their appointment. And then when they are in the infusion, then there's a third check to make sure that they are appropriate. If anybody has any questions or they're not sure of criteria, they can always reach out to us, and as well as the COVID monoclonal antibody committee. And really just education has made everything much smoother for nursing, making it standard, for pharmacy, making it standard, making standard documentation has really been helpful, and making the pharmacy practice very standardized, especially with also monitoring the stock is worked into the process that we always know what we can give of which product.
In the end of the day, the goal is to care for these patients that are ill. We do this every day here. We have very sick patients that are diagnosed with cancer and have other therapeutic immunology issues as well that we're treating. And I think that you're pulling your resources and your space for those patients, but you're also helping these other ill patient population that have COVID-19. So either way, yes, you're pulling from your resources and it may be a challenge, but in the end goal is to always focus on the patient care, which is what we do here. And we're accustomed to acclimating to it and always open for the challenge to be able to do so. And so far everything has gone really well, and the staff were all very much on board and really excited to actually be involved in this unit and be able to help these patients get better.